Hello, I'm Dr. Vishwas. I'm a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I'm Chris Adult, 55 years old.
Okay, nice to meet you. I came to know from your GP letter saying that you have chest pain for last 1 month. Is it right?
Yes, doctor.
Okay. I am going to take detailed history and I may take some note during my conversation. Will it be okay for you?
Yes, doctor. It's very quite okay.
Okay. All the information during our discussion will be remain confidential. Okay.
Okay, doctor. Okay.
Okay. So can you please tell me in your own words what has happened to you?
Well, doctor, for the last 1 month, I think, doctor, I have been facing some chest pain. Okay, so uh, it actually it's actually disturbing my life nowadays. I have heard that people having chest pain sometimes have some heart condition. Okay, so now I'm over 50, so I'm a bit worried, doctor, whether I have any heart attack or something like that. What's going on, doctor?
Yeah, I'm sorry to hear that. Uh, I am going to ask you a few questions. That can you please exactly tell me where do you feel the pain?
I think, doctor, it's quite in the mid part of my chest. I think, doctor.
And did it start suddenly or gradually?
I think, doctor, it's quite gradually, doctor.
And do you think that the pain is increasing in severity?
Doctor, I think that recently, I think it's for the 1 month, but recently I think it's slowly increasing in severity, doctor.
Okay. When it start? For how long it persists?
I think, doctor, for 1 to 2 hours.
That is a quite big time. And can you tell me that how frequently do you feel this pain?
Doctor, I think I feel once or twice a day, doctor, nowadays.
That is quite big problem. And is the frequency is increasing day by day?
I think it's more or less same, but I think gradually it's increasing.
Okay. And can you tell me that how do you feel the pain or how will you describe the feeling of your pain?
I think, doctor, it's quite dull. It's not very sharp or that I have been severely agonized. It's not like that, doctor. But I think it's quite dull, but it's disturbing, doctor.
I can understand. And can you tell me that does this pain go anywhere?
No, doctor, I haven't felt so.
In your tummy or in the back?
No, doctor, I have not felt so, doctor.
And along with this pain, do you have any other problem like any shortness of breath,
No, doctor, I haven't felt.
any chest pain,
Doctor, I have come with chest pain, doctor.
any other chest pain do you have?
Oh, no, doctor.
Okay. And any cough?
Doctor, sometimes I have some cough, doctor.
And when do you feel the cough?
I think, doctor, more at the night time, doctor.
And do you think that the pain is more after lying down and cough is more after lying down?
Doctor, I think so, doctor. Sometimes I feel it more at that
And
time.
both your cough and your pain?
Yes, doctor. Yes, yes.
Okay. And have you noticed that anything make your cough better, like sitting down or taking some water or anything else?
I think, doctor, sometimes sitting down makes me feel bit better.
I can understand. For when the cough start, for how long it persists?
It's. I think, doctor, for about the same time, 1 hour, half an hour, like that.
Have you ever produced phlegm?
No, doctor, I haven't produced it.
Have you ever coughed out blood?
No,
And I am coming with your chest pain. And have you noticed any nausea or vomiting?
uh, doctor, not that much, doctor. Once or twice I have vomited, but it's not that severe, I think.
And can you tell me that what was the content of your vomit?
I think it's food, doctor.
And have you noticed that if you have vomit out undigested food particles from one day or even more than one day before you have eaten?
I haven't noticed, doctor.
Okay, that
I
is
think
not
that just I haven't noticed
okay.
so detailed.
That is not a problem. And have you noticed that after vomiting out, your symptoms have been somewhat eased or felt better?
Doctors, at times I felt I actually had only once or twice that problem, but
Okay,
I felt that
that is not a problem. So, and can you tell me that if you have noticed any variation in the time with your chest pain that you when you feel the chest pain more any daytime or night time?
I think it's more in the night time, doctor.
Any relation with the food?
Mm, doctor, I cannot tell it quite uh, quite surely, but I think it's more in the night time and also at the morning at times also. I feel that it's more this chest pain.
Okay. And have you noticed anything that makes your pain feel worse?
So, doctor, I haven't noticed anything specific.
Anything makes it better?
No, doctor.
And how will you score your pain? If I tell you to score from 0 to 10, where 0 is the least pain and 10 is the highest pain?
Doctor, I will think it's 4 to 5.
Okay, I can understand. And I'm going to ask you a few other question. Okay.
Yes, doctor.
Do you have any headache?
No, doctor.
Any rash anywhere in your body?
No,
Any changes in your vision?
no, doctor.
How about your appetite?
It's quite good, doctor.
Have you noticed any changes in your weight?
But one thing is that although I want to eat, sometimes I feel uh, some problem while eating. Doctor, I have some problem while eating at times.
Do you mean stuckness of food or anything else?
Doctor, sir, at times, doctor, I think so.
Okay. And where do you feel the stuckness?
I think it's a throat, doctor.
Okay, I can understand. And have you noticed that anything makes your stuckness worse or better?
I haven't noticed, doctor.
Okay, that is not a problem. And have you noticed any change in your weight?
No, doctor.
Any swelling, any hot or cold preferences?
No,
Any lumps or bumps anywhere in your body?
no, doctor.
Okay. Yeah, how about your water work?
It's quite all right, doctor.
How about your bowel habit?
Quite all right.
Have you noticed about any black stool or any blood in the stool?
No, no, no,
That is one okay. That is fine. And do you have any weakness at any side of your body?
no, doctor.
Did anyone say that you are becoming pale?
Uh, no, no, not specifically, doctor.
Do you have any joint pain?
Doctor, yes, that's another issue, doctor.
Where do you feel the pain?
Doctor, I feel more pain in the hands, doctor.
And have you noticed the more pain in the morning time or any
Yeah,
presence of
yeah.
morning pain?
Actually, doctor, I want to say that it's not a new thing. It's been for around 10 years now. I have some pain in the morning, some redness and swelling, and I went to doctor and I was diagnosed as a rheumatoid arthritis patient, and I've been taking some medication for it, and it's more or less under control now.
Okay. And I'm,
I take some medication for this also.
have you noticed any changes, any thickness in your skin,
No, doctor.
any thickness or any shortening of the oral cavity or your
No,
mouth?
doctor. No, no, no.
Any changes in the color of your fingertips sometimes?
No, doctor.
Okay. And you said that you have rheumatoid arthritis. Is it under control?
I think so.
And
I better nowadays.
and may I know that what are the drugs you're taking now?
Doctor, I told actually I have been taking steroid and methotrexate, I think, for this rheumatoid arthritis problem.
Are you taking any bone protecting agent?
Doctor, actually, what happened? I usually didn't take that bone protecting agent, but Uh, 2 years back, I had a fracture, doctor. And from that time, I took some bone protecting agent, and I have been doing some scanning on and off to have a look at the bones. Doctors told me to have that scan. And recently, around 1 or 2 months back, 2 months back, doctor, actually, I had an increase of that bone protecting agent dose.
Okay. And may I know that what are the medications you are taking, or can you show me your medication list?
Yes, it's steroid, methotrexate, and uh, alendronic acid.
Okay. And are you taking alendronic acid properly? That is, after taking, do you stand for a half an hour?
Doctor, at times, doctor, don't take it very seriously.
Okay. And may I know that do you have any allergy to any medication?
No,
Okay. Yeah. Do you take any herbal products,
no, no, no,
any over-the-counter medication?
no,
Okay. Any of your family member have this type of condition?
no, I don't know of it.
Any history of cancer in your family?
No,
Is it okay if I ask you a few personal questions?
yes,
Do you smoke cigarette?
no, doctor,
That is fine. Have you ever smoked?
no, doctor. I don't like smoke.
Okay, that's fine. And do you drink alcohol?
Within the social limit, doctor.
Okay, that is good. And may I know that what do you do for living?
Doctor, I'm a school teacher.
Okay, and may I know that do you think that you need any social support, any support with adjustment at your job due to this problem?
Doctor, I'm not very much bothered in the job, but it would be better because I need some sleep. Everybody needs sleep, but I think at times it's hampered because of this problem.
Okay, I can understand, and I will surely try to help you. And at this point, may I know that what is your concern?
Doctor, actually, what's causing this? Okay, what is the cause of this?
Okay, and as I have taken your history, it seems that you have some problem with your food pipe. That is, the food is not passing into the stomach from the food pipe in a proper way, so that you are having this problem that is stuck in this pain. And to rule
Okay,
out this, I need to first fully examine you, and then I need to run some blood test, some camera test, and also some imaging test of your chest and your food pipe. And after that, I could give you the best explanation.
okay, doctor. So
All
will it be cured?
and, at this moment, I am not quite sure what happened to you, and there are some possibilities of having some other sinister condition, like having some cancer. But I cannot exactly tell you that these are your diagnosis. But there are possibilities of also having that.
Okay, doctor.
So, do you have any other question for me?
Well, doctor, will there be any problem with the medication? Actually, I went to my GP one day, and he told me that there can be some problem because of the medication as well. What about it, doctor? What do you
Okay.
think?
Okay. There are also some relation with the medication. So we will discuss this condition with the bone doctor, with the joint doctor, and after that he will review your medication, and we will advise you on the next medication, because some alendronic acid is also related to this condition. Time up.
Okay, okay, okay. So, what's your diagnosis? You think?
For this gentleman, I have a few differential diagnoses. That is, I think it is a case of gastroesophageal reflux disease that can be due to the that can be gastroesophageal reflux disease that and also other differentials diagnosis includes achalasia cardia, carcinoma of the esophagus, and also esophagitis due to taking his alendronic acid.
Okay, GERD itself can be caused by esophagitis, or esophagitis can be a complication of GERD as well, I think.
And also,
Okay,
I will consider this is a case of uh, uh, ischemic heart disease also.
Okay, okay. So what you thought, I think GERD can itself be associated with esophagitis. Okay, I think that will be a very possible DT here. Okay,
Okay.
yeah, because it's both a complication, and I think GERD itself can be associated with esophagitis. Okay, you told that it can be achalasia cardia, or it can be uh, or say esophagus. Did you exclude whether it's more, that problem in food sticking is more due to solid or liquids?
Okay, I could have asked more about that, but I had less time, so I couldn't
Okay,
cover that. But I should
that's
have
all
asked
right.
about that.
Okay, and did you ask more about his personal disease history? Like, did he had any high blood pressure or high blood cholesterol level?
I asked her only if he had any past medical condition. I should have also expressed that if he had any high blood sugar, especially high blood sugar.
Yes, yes. I think you should have asked it. And okay, that's all right. Other things, and you have done quite well. And what investigations should you done? Do you think?
For this gentleman, I will go for the complete blood count to see anemia and white blood cell count level, then inflammatory markers. After that, I will go for the liver function test, renal function test, even for routine examination, random blood sugar level, and then I will go for the barium follow through. Then I will go for the chest X-ray, and after that, I will go for special investigations like endoscopy of upper CIT with biopsy if needed. And
Okay.
also I can go for the 24-hour esophageal pH monitoring.
Yes. Yes. 24-hour is monitoring is a high resolution is a visual manometry. Okay. This could be done. Another thing, can you please tell me that if the patient had bad breath uh, along with this type of symptoms, what investigation would have been very important?
For the gentleman, that investigation of barium meal would be important to rule out esophageal pouch, because having esophageal pouch will impose him risk to perforation from
Yes, yes,
endoscopy.
yes. That's very good. Well, suppose the person has you are suspecting esophageal cancer, okay, in the biopsy. Suppose, okay. Then what specific investigation should you do to look about the loco-regional involvement and the esophageal wall involvement? It's a new investigation getting
Yeah,
more and more popular day by day.
that is endoluminal ultrasonogram.
Yes, yes, you can tell it endoscopic ultrasound. It's getting very, very popular, and it might replace ERCP MRCP as well. It's getting very, very popular nowadays, specifically in any case of biliary and pancreatic disease. Okay, endoscopic ultrasound is getting very, very popular, and specifically in also in case of esophageal cancer, it is also getting very, very popular. Okay, okay. Now, what should be the management protocol management for these patients?
Okay, first I will diagnosis the case, and as the presumptive diagnosis gastroesophageal reflexes. So there will be first educating and counseling the patient, then some non-pharmacological management like lifestyle management, like
Mm.
his reduction of his weight, then some lifestyle management like elevating his weight, then reduce consumption of chocolate, tea, and coffee, and then some pharmacological management, that is motility drugs, that is can be metoclopramide.
Yeah, yeah, yeah. Okay. And
Also
suppose
proton pump
if
and also
okay,
proton pump.
suppose this condition is not improved by this medication, then what would you like to do?
Okay, and for this I will go for the investigations, that is uh, endoscopy, superficial pH monitoring, and after that referral to the gastroenterologist.
Yeah, yeah, but do I think it's I think fundoplication can be important. Okay.
Yes, the surgical like fundoplication, then other banding.
Yeah, yeah. That's all right. So I think that's all right, and you have done really, really well for the case. Do you yourself want to add anything?
No.
Okay. Okay. So thank you. Would you like to do the next piece or would you like to take rest today?